Standing Voice is a UK registered charity with offices in Tanzania and Malawi. We were founded in 2013 with the mission of defending the rights and well-being of people with albinism in Africa. We work very broadly and holistically to combat the challenges that people with albinism face. We have programs in health, welfare, economic empowerment and education. Our programs are built to be scalable and embedded within local systems so they can be easily replicated into other countries in Africa. In response to the skin cancer crisis facing people with albinism, in 2013, Standing Voice launched the Skin Cancer Prevention Programme in partnership with the Ministry of Health and Regional Dermatology Training Centre in Moshi. This programme today has grown to be the largest skin cancer prevention programme in Africa, operating in 23 regions of Tanzania and reaching over 11,500 people across Tanzania and Malawi. When a person with albinism arrives at a clinic, they register into the programme. Once they're registered, they move to a waiting area where they will receive health education. That education broadly covers the basic genetics of albinism, the dangers of skin cancer, and managing sun protective items such as how to apply sunscreen, the importance of wearing a sun hat, and things like that. After they've received education, they're called in one by one to have a doctor's consultation where they will receive a skin examination, cryotherapy treatment if it's needed, and a referral for more advanced surgery if it's necessary to one of the central referral hospitals across Tanzania, such as the RDTC, Muhimbili and Bugando Hospital. A big area of our work is our advocacy, and we do that in many ways, and that can be from producing educational resources that are distributed widely, promoting and celebrating International Albinism Awareness Day. We do community-based film screenings, so we take screens into communities and do talks and engagements. And we did pop-up theatre performances in communities where we take narratives around albinism, such as a husband leaving their wife because they've given birth to a child with albinism, and then we perform that in a marketplace as a real moment. So it draws in the community because they think it's real, and that creates sort of real engagement about how people truly feel about people with albinism. So it was a very interactive and kind of socially accessible way to talk about the challenges of albinism. Through all our advocacy work, we try to amplify the voices of people with albinism. That is our absolute priority, so they can be seen and heard, and we won't stop until we see their full inclusion in society. 91% of our registered patients are unemployed and 71% are living in extreme poverty, which makes it a challenging environment to work in. In locations we've been working longest, we have seen great reductions in skin cancer, but we are still seeing progressive cancers in the new locations we're opening. So it just makes it really important to ensure that we get those patients to return regularly and they're given the urgent treatment they need. And that ranges from delivering cryotherapy to burn off precancerous lesions before they progress, but also making sure there's a strong referral network to refer patients for more advanced cancer treatment.
Since Standing Voice started to operate in Tanzania, the quality of life for people with albinism become better because they get education on how they can protect their skin. Also, they can get eye examination, and they can get sun protective gears like one breathed hat. They can get sunscreen lotion. So life for people with albinism improved compared to 10 years back. Standing Voice paving a way to other NGOs to include people with albinism in their service and their work. So other organizations, they should follow what Standing Voice do, because disability is not inability, and as people with disability, we need to be included in all things that surround us.
People with albinism face many challenges. Of course, extreme vulnerability to skin cancer, visual impairment that impedes their ability to learn and then go on to get jobs, but also extreme forms of discrimination. One of the worst forms of discrimination we see against people with albinism in Tanzania and across Africa is witchcraft-fueled attack, murder and mutilation. Witch doctors have been spreading the belief that the body parts of people with albinism can bring wealth and fortune, and this has led to the murder and mutilation of over 830 people across the continent since 2006. I have a cousin who has albinism, so I've always been aware of the challenges that people with albinism face, but it never crossed my mind that being born with albinism in Africa could lead to such extraordinary and extreme forms of discrimination. And the reason why we adopt a very holistic approach to combating the challenges is because the challenges are so wide-ranging and they are all completely interlinked. If you have bad skin health, you're not invested in by your family. People don't understand your condition, they won't send you to school, and therefore you can't get a job, and therefore the wider society rejects you. So all of these things are interlinked, and we try and combat them all through a very sort of holistic set of programming. Long-term sustainability of the skin cancer prevention program is at the core of what we're trying to do. We're building a network of clinics that is embedded within the Tanzanian health system. And in order to do that, it has to be locally led. We have to keep encouraging the government to invest in the program. Currently, they cover the salaries of the dermatologists. In very remote areas, they sometimes send ambulances out to collect patients in extremely rural areas where we maybe can't get a clinic. But of course, the true marker of success of the program will be them taking on the whole program, which is what we're aiming for and we hope we can achieve. Our hope for the future is that people with albinism have access to the healthcare that they so urgently need. We want them to be included in society, so they're given the platform and the opportunities so they can really excel and thrive in society and really do anything that they want to do in life.